Hi, my name is Danielle Stiles. I am a fourth-year student at the University of Cincinnati's College of Allied Health Sciences, currently finishing my education in the Advanced Medical Imaging Technology program. Today I will be presenting my capstone project on medical imaging the respiratory manifestations of cystic fibrosis. Cystic fibrosis, or CF, traditionally has been defined the most common life-threatening inherited disorder of children in the Caucasian population. 30 years ago, the CFTR gene was discovered. The CFTR gene, or the cystic fibrosis transmembrane conductance regulator gene, is responsible for providing instructions to make the CFTR protein. This protein is found in cells and regulates the function of various channels that are necessary for normal functions of organs in the body. To have CF, you must inherit 2 copies of the CFTR gene that contains mutations. 1 copy must be from each parent. That means that each parent must either have CF or be a carrier of the CFTR gene mutation, as depicted in this image. CF affects various body systems, but pulmonary complications are the leading cause of morbidity and mortality with this disease. The CFTR channel transports negatively charged ions, chloride ions, in and out of the cells. When this channel doesn't work, the movement of water in tissues is interrupted. The movement of water is necessary to thin the mucus that lubricates and protects the lining of airways. Without this proper flow of the water to the tissues, this mucus becomes thick and sticky, causing many problems in patients' lungs and respiratory systems. Medical imaging plays a very important role in the diagnosis, monitoring, and evaluation of CF. In fact, patients with properly managed CF may need some form of medical imaging every 2 to 4 years. Patients, however, that struggle with management of the disease may require more imaging more often. Repeated imaging from various modalities of the lungs affected by CF has proven to be sensitive enough to detect both anatomical and physiological changes. For starters, it can determine and monitor various treatments for patients, may even enable patients to undergo other treatments. It evaluates the extent of the disease, detects manifestations from the disease, and also allows for diagnosis of CF. The purpose of my research was to evaluate the costs and benefits of each modality that is clinically used when imaging a patient with CF, but also to compare and contrast the information that each modality can offer to caregivers that are treating patients with CF. There was a lot of research done on each of the modalities used, but there are also research undergoing that can provide other information to best provide care for patients with CF. A radiologic technologist from my research says that chest radiography is a preferred method for initially evaluating the respiratory disease related to cystic fibrosis. This is because the examination requires a low dose of radiation, and it can also provide images of the lungs and show any anatomical abnormalities. These are normally visualized as mucus plugging, hyperinflation, bronchial thickening and dilation, flattening of the diaphragm, mucus impaction, and generalized overinflation of the lungs. In addition to analyzing the anatomical abnormalities, there are scoring systems used to evaluate the severity of CF in the pictures. The Brasfield and Wisconsin scoring systems are the most frequently used when analyzing chest radiographs. The Brasfield system evaluates air trapping, linear markings, nodular cystic lesions, large lesions, and general severity of the disease on the lungs. Depending on the interpreted severity, they're evaluated on a scale from 1 to 5, with 5 being the most severe. These scores are summed up, subtracted from 25 to give a final score. It's a quick and easy method for radiologists to evaluate the disease. The Wisconsin scoring system evaluates hyperinflation, peribronchial thickening, bronchiectasis, nodular and branching opacities, larger opacities, and atelectasis. All of these are furtherly evaluated in subdivisions. This scoring system is more complex, time-consuming, and way more detailed compared to the Bras field, but the two together have statistically a significant correlation between the two. These scores allow the patient's care team to determine the best approach to treatment for the patient. Chest X-rays are able to produce informational images. However, computed tomography, or CT, offers higher resolution and the production of a 3D image of the lungs. CT is the better modality to use when detecting early signs of the disease, as traditional chest X-rays are not able to do that. CT is even able to detect disease before it has even shown any signs or symptoms in the patient. The use of this modality has also replaced invasive procedures such as contrast bronchography that evaluates the structure of the patient's bronchi. In the clinical research setting, CT has been used to evaluate potential CF treatments and has been more specific than lung function tests when determining long-term effectivity. It seems that pulmonary CT would be the most ideal modality to use when diagnosing, monitoring, and evaluating CF, as it produces the images that provide most information. And it also seems the most beneficial for patients as it detects disease early before other modalities. But the downfall of the CT is that the radiation dose of the patient would be exposed way more during the procedure. One source in my research says that relatively high radiation doses from the CT limit repeated measures. Patients can live with CF for up to 50 years, and considering how often patients with CF need chest radiographs, the amount of radiation dose adds up and would ultimately mean a higher exposure of radiation to the patient. Recently, digital chest tomosynthesis, or DCT, has been proposed as an alternative to chest radiography and CT. DCT is an imaging technique in which a 3D image is reconstructed using X-ray projection images acquired over a limited scanning angle. A study was performed exploring the potential of DCT being used in CF imaging, and image quality was rated significantly higher compared to traditional chest radiographs. Additionally, tomosynthesis scores show comparison to the Bras field scores with little difference, and there is a significant correlation between pulmonary function tests and the CF severity score system for the DCT. This modality does have potential to become a valuable tool to evaluate CF, but research is still ongoing. DCT can also be called DTS, digital tomosynthesis. It just depends on where you are at. Considering the number of repeated imaging studies needed when monitoring and evaluating progression of CF, it would be ideal to image a patient without having to worry about radiation exposure. In previous studies, magnetic resonance imaging, or MRI, has proven to be comparable to the use of CT when assessing anatomical changes in the lungs. MRI is less frequently used in the clinical setting because the test is very lengthy and usually requires sedation for pediatric patients. Many have overcome these challenges with various strategies, and since MRI shows promise to provide the patient's care team with valuable information about the patient's lungs. The use of MRI allows the analysis of the anatomy and the function of the lungs. Pulmonary perfusion can be evaluated with contrast-enhanced 3D MRI acquisitions, allowing radiologists to detect tissue destruction. Reversibility of perfusion defects may also be evaluated with MRI when analyzing response to therapy, as well as differentiating between reversible and irreversible damage. Oxygen-enhanced MRI may also be used to evaluate the the patient's lung ventilation. With this method, either gaseous molecular oxygen is inhaled and serves as a contrast medium, inducing a dose-dependent signal increase in T1 weighted images, or they inhale a hyperpolarized helium gas. This method is more sensitive and provides more similar information, but requires patients to hold their breath, which may be difficult to do. One study done compared the use of CT and MRI in patients with CF and analyzing morphological information. The results of this study showed a strong correlation between CT and MRI, and it can be concluded that through this study and similar ones that were done, that MRI is comparable to CT when assessing patients with CF. Positron emission tomography, or PET, has shown it is capable of detecting inflammation in the lungs. With this modality, fluorine-18 fluorodeoxyglucose, or F18-FDG, is a radionuclide that imitates sugar. It's injected into a fasting patient and travels to areas in the lungs where inflammation is present. This is not routinely used because the high metabolic activity of the heart muscle will concentrate more of the radionuclide than the lungs. But a study done at the Washington University School of Medicine reveals that imaging with PET and FDG can be used to assess inflammatory burden in patients with CF. As of now, there is no cure for CF, but there are palliative treatments available to patients with CF. One treatment option would be lung transplantation, but this is an option for patients with advanced lung disease or when their diseased lungs are not able to provide the body with its oxygen needs. Lung transplant can extend and improve quality of life, but it also is a multi-phase process with extensive evaluation and requires some lifestyle changes. Patients are placed on a transplant list ranked by urgency, where those higher at risk of dying are placed higher on the priority for new lungs. These rankings are represented by a number called the LAS, or Lung Allocation Score. It ranges from 0 to 100, and the result of the calculation that considers patients' age, body mass index, and results to certain medical tests, and results to what radiologists read from the pictures. Airway clearance therapies are also a form of treatment that include various techniques that loosen mucus so it could be cleared from the lungs by coughing or huffing. Riddance of this mucus will decrease the likelihood of the manifestation of lung infection and improve the overall function of the lungs. These treatments start with bronchodilators, which allow the bronchi to widen and relax. Then medications are prescribed and administered through inhalation, usually from a nebulizer, and that helps loosen the mucus and make it less viscous. Antibiotics may also be inhaled after lungs are cleared as much as possible, which would allow bronchioles and alveoli to acquire the antibiotic and attack any bacteria. Cystic fibrosis is a very serious disease as it affects the patient's lungs and other organ systems in the body. Living with this disease is difficult as it involves extensive monitoring of the disease's progression and evaluating any other respiratory diseases related to CF. Patients undergo lifelong treatment, and there is no cure to this disease. Medical imaging has provided patient care teams the ability to detect respiratory diseases and morphological abnormalities, evaluate treatments and lung ventilation, and even determine pulmonary perfusion. These advancements in technologies and further research in detecting pulmonary pathologies associated with CF has helped patients improve their quality of life and even elongate it. Research is still ongoing to further evaluate the routine use of MRI in patients with CF. However, it is looking very hopeful, and hopefully we will figure out a cure to CF. Thank you.